Good day to everyone. This will be the last part of our lecture series on drug abuse. In this session, we will talk about the government program, especially for the Philippines, as with regards to drug abuse. These are the five pillars of action as an anti-drug strategy of the government. Drug supply reduction pillar states that supply reduction strategies are directed toward enforcing the prohibition of illegal drugs and regulating and enforces access to legal drugs and substances, particularly those that are of high probability for abuse, including pharmaceuticals and other precursors and essential chemicals. For drug demand reduction, this is geared towards reducing the consumer's demand for drugs and other substances. This is done through programs of preventive education, treatment and rehabilitation, and research. Along with its partner agencies, the Dangerous Drugs Board continues to formulate policies on drug prevention and control, develop and implement preventive education programs, adopt and utilize effective treatment and rehabilitation programs, and conduct research on vital aspects of the drug abuse problem. For the alternative development pillar, alternative development is among the multi-pronged drug control strategies being undertaken by the Dangerous Drugs Boards, through which prevention, reduction, and elimination of illicit cultivation of marijuana plants are achieved by specifically designed rural development measures that are aimed at providing lawful, economically viable, and sustainable means of income, as well as improve livelihood of people in known marijuana cultivation areas, specifically targeting those involved in the illicit activities. For the civic awareness and response pillar, strategies under this pillar aim to stimulate discussion and generate public opinion that leads to participation. The Dangerous Drugs Board utilizes different forms of media to spread an anti-drug advocacy and enlist more and more people in the fight against drugs. The different sectors of society are encouraged to participate in programs through increasing awareness and enhancing public understanding of drug dependence. To reach a greater majority, cooperation and coordination with media organizations are also maintained. For the regional and international cooperation, the regional international cooperation pillar places emphasis on cross-border strategy sharing and regional activities, while enriching the existing national responses and capacity building programs which represent the foundation of the national anti-drug abuse advocacy. There's a great deal of common complementarities between the national and regional response, as would be seen in the conferences, symposia, and fora participated in by the country. These demonstrate that the Philippine advocacy against drug dependency shares the same overall regional approach to program development while meeting the contextual and cultural requirements for our country's needs. The five pillars were originally from the Aquino administration. Duterte reduced it to four pillars and focused more on drug demand reduction by Operation Tukang. President BBM coined his program as Bloodless War on Drugs or Bagong Pilipinas as a sarcasm to Duterte. These are the previous alternative development programs of the Philippines, of the government. As you can see, they provided livelihood programs to those who are farming marijuana to stop them from farming marijuana. These are the drug demand reduction programs of the government. We have policy formulation, preventive education, treatment, rehab, and research. These are the drug abuse treatment programs currently in place in the Philippines. So we have community-based treatment and rehab, health facility-based outpatient treatment and rehab, inpatient treatment and rehab, and the Balay Silangan, which is the new program of the Marcos administration. Okay. The outpatient treatment and rehabilitation program are what we are opposing in the drug abuse treatment programs of the Department of Health. The law states that the outpatient rehabilitation is only for out-of-school youth, but the Department of Health opened it for all ages instead of just out-of-school youth. We really do not believe that outpatient rehabilitation will work in the Philippines. As a panelist in the 2017 PNHR's Drug Abuse plenary session, I have discussed at length how and when outpatient rehabilitation works. None of the things that I discussed are present in the outpatient rehabilitation centers in the Philippines. First and foremost, this is a behavior modification program. Outpatient deals more with psychiatrists and psychologists. Outpatient rehabilitations in the in the Philippines are manned not by experts but by former drug dependents who do the counseling process. So how would they know how to operate behavior modification programs? These are the current number of accredited rehabilitation programs in the Philippines, and this increased because of after the program of Operation Tukhang, because a lot of drug dependents would now want to go to rehabilitation centers to escape from being killed during Operation Tukhang. These are the preventive education programs that we have implemented through the years, some of which are still being implemented, like the DARE program or the Drug Abuse Resistance Education. The drug abuse resistance education is being conducted by policemen in grade 5 and 6 public schools. These are the capability training programs being implemented. So we have for health workers, for primary healthcare practitioners, for overseas Filipino workers, and so on and so forth. These are the civic awareness and response programs that are being implemented in the Philippines. So Idada Eat is an annual event, and we have sponsored a lot of the Idada Eat programs, and this involve other countries. STEP is the systematic training of effective parenting, targeting parents of drug abusers, and this is part of the programs for STEP. These are Barcada contra Droga posters being disseminated by the Dangerous Drugs Board. In summary, after all the 5 videos, I have talked about the typical profile of a drug user, the common drugs of abuse and its effects, the treatment modalities for drug abuse, and the preventive strategies being employed in the Philippines against drug abuse. As a take-home reminder, remember that drug abuse is a disease, and as such, the abuser should be treated and put in a rehabilitation center and not in jail or cemetery or suffer from tokhang. Rehabilitation really works. So let's care for our patients. We are doctors and drug abuse is a disease, so we must care for our patients. Since PDEA became the center of the drug abuse program instead of the Dangerous Drugs Board, the focus became drug supply reduction and not drug demand reduction. Drug supply reduction will never work. In rehabilitation centers where there are no drug presence, the patient still manages to get high. How? You would ask. What they will do is they will mix cocktails of Mentos or menthol toothpaste, yeah, the Colgate or Close-Up toothpaste, with orange juice. Then they will mix it up and then they will drink the mixture of Mentos or menthol toothpaste and orange juice. And they will get high by drinking this. Okay? Cigarettes are also prohibited in the rehabilitation center. So what they will do is finally chop the brooms, the brooms with from Baguio. Okay. Then they will tear a page in the Bible because the Bible pages are so thin. And they will use this as a rolling paper where they will put the finely chopped broom and smoke them like cigarettes. And they get high from this. So drug supply reduction will not work because people will just invent new ways of getting high. And based on the lecture that I have provided, newer drugs are being invented every year. So these are my references, and these are just nice pictures for uh, drug abuse prevention. These are some posters on alcoholism and drugs that are available. Still some good pictures. Oh, these are pictures of children born of drug-dependent patient parents. Okay. And here are also children born of drug-dependent parents. These are pictures of children who are living in met labs. And lastly, remember that smoking kills. So this end my session on drug abuse epidemiology of drug abuse. Please don't forget to like our videos and subscribe to our uh, Yahoo Tube channel. Okay. And don't forget to rate the lectures. Okay. So thank you very much, guys.